I was like, well, we're gonna do it. And so we moved her to the operating room and did her C-section under local anesthetic under lidocaine effectively.
Oh my gosh.
Yeah, yeah. So
And your hand's shaking, isn't it?
no,
We could say
yeah, well,
no?
it's yeah, exactly. It's one of
Yeah.
those things, and it's like, the scrub tech's not there yet. So the nurse and I, we ripped open the operative pack and we put everything together and the patient's on the table. I luckily had a strong team of nurses keeping the patient calm and drew everything up quickly and injected and went. But like it was one of those things that was like, holy smokes, like it's just me, like I'm gonna be responsible for this kid, this mom, like
Yeah.
the most abundant amount of prayers coming up from me up to the heavens was going on at that time.
Welcome to the Patient to Professional podcast. My name is Dr. Nick Despotidis, and I've had the privilege of examining thousands of children through the years who are now professionals. Today, I'm so excited to have a very special guest, Dr. Joshua Paul. Dr. Paul was my patient when he was in elementary school, and I've had the privilege of seeing his career blossom over the past 2 decades. And he's been very gracious with his time, lunchtime actually, to share his path. Dr. Paul, thanks so much for joining the podcast.
Yeah, no, absolutely. My pleasure being here. Thanks for interviewing, and I'm happy to answer and any questions, you guys might
Okay.
have.
I have a lot of them. So,
Perfect.
the reason I invited you, a lot of parents are not medical professionals and they encourage the kids to consider medicine. And I wanted you to explain your current career, what type
Yeah.
of medicine you practice, and we'll slowly go backwards to see what your path was like and what kept you going throughout this path. So
Yeah.
tell us a little bit about the type of medicine you practice right now.
Yeah,
What
yeah,
kind of doctor
certainly.
are you?
I'm a generalist OBGYN, so I take care of women's health. I take care of patients as young as 5, 6, all the way into, I've had patients this past week in their upper 90s.
Wow.
So full scope, right? So I do the full scope of gynecology plus obstetrics. So I deliver a lot of babies. And so yeah, so that's kind of the bird's eye view, if you will, of what I do. In terms of what brought me there,
No,
that's
let's talk about your typical day. Let's
oh,
just
okay,
like
yeah,
today. Today,
yeah. Today,
today is
so
what? We're Thursday. What
yeah,
does Thursday look like?
Thursday, man, I probably get to the office 7 o'clock in the morning. Today's a busy clinic day. I see anywhere between 20 to 30 patients per day of both the
Wow.
obstetric and gynecologic variety. In between there, I'm also on call, right? So I'll be making trips to the hospital to deliver babies for my patients who are laboring, as well as any ER visits. So that's a typical day for me. Sprinkled in, I do operate, so I do women's health surgeries. So on those days, I get here a little earlier, probably around the 6:30 mark, in order to be ready to go in the operating room. And I'll probably operate all day till about 4 or 5 o'clock in the evening.
Wow, wow. So
Um,
so stop right there. That's amazing. So you have a specific day of the week that you do your surgeries?
Certainly, yeah, I operate probably I have 4 OR days per month, so
Okay. So about one a week. And
yeah.
those OR days, you start very early in the morning and
Yeah,
you
yeah.
go almost straight through to four
Straight
o'clock.
through. Yeah, correct. Yeah. And so, we'll get snacks in between, but usually I try and line up my patients, back to back to back. So, efficiency to some degree, but also, keeps me in an OR mindset, if you will.
Okay. And then so you have about one surgery day a week. And how many
hmm
clinical days like today do you have in a week?
Oh gosh, I would say the remainder are clinic days, right? So I do, yeah, I'll see like 4 clinic days a week, and then I will take like one 24-hour call on labor and delivery. Probably about it's like 3 to 4 per month.
Okay. So it sounds very busy. So you're working a solid 5 days a week.
Mhm. Yeah.
Sounds like full days, more than
Full
eight
days.
hours a day,
Yep.
right?
Yep. Yeah. 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 I would
And
say, yeah, easily more than 8 hours a day. And
yeah.
that's not counting. I mean, at home, in today's day and age, you get notifications from the hospital to your phone. So, at home, sometimes I'll be fielding call questions and stuff on my patients. even when I'm off. So there's not there's some times where I'm truly off, but that's few and far between.
That's all consuming. So it really, really consumes you. So
Hmm.
let's talk about how you ended up here, obstetrics
Yeah.
and OBGYN. Can you take us back a little bit when you were in medical school? Did you have this in mind? Tell us a little bit
Yeah,
about
yeah.
that.
Actually, I mean, it was a little bit of a surprise for me. I actually, medical school is a little different now than it was when I was in medical school. I think back when I was doing it, you had your first 2 years as your didactic years, and so
That's
you just
correct.
spent those out of the clinical setting, and then your latter 2 years, your third and your fourth year, were going to be your clinical setting, and so I had actually arranged my schedule so that two specialties which I thought I did not want to go into, which would have been OBGYN and peds, that I would get those knocked out first.
Interesting.
Yeah, and I did my OB rotation, and it was a very good rotation. I got to do way more than I thought I would, and I enjoyed it so much more than I thought I would. As I got to see patients in all stages of life, both very young all the way to very old, and I got to take care of people at points in their lifetimes which are memorable, both for good reasons and bad. Um, and the doctors that I kind of shadowed and helped, take care, they kind of taught me that these points in folks' lives, like a birth or even a miscarriage, things like that, they can be emotional highs to the most emotional lows, but it's your job to kind of be with them through that process regardless and help guide them. And to me that stuck out because I think that that's a very longitudinal point of care, where I can kind of see them back. I can see them back for a successive pregnancy, see them back for a gynecological reason. And so that's kind of where that surprised me enough that I put it out on a list of
Wow.
what I could do, before applying and making a final decision in residency.
Did you like the surgical aspect? Because this
I,
is a very difficult career on many fronts, but you
yeah,
just reviewed very nicely. There's an emotional component.
yeah,
People
yeah,
are very vulnerable. I
yeah,
would say
yeah.
the most
The
vulnerable
most
when they're
vulnerable,
with
correct.
you.
Yeah, no, absolutely. You see people in all stages of their, like I said, some of the very happiest moments and some of the probably the lowest points of people's lives. And, the surgical aspect is also something that attracted me because, I get to operate a ton. I do a lot of minimally invasive surgery, but also, doing a C-section. It's one of the few open laparotomies that we do in 2025. There's just no minimally invasive way to get a kid out of the belly, right? So
That's right.
you do get a vast variety of procedures, some of which have been in place for years, and at the end of the day, medicine evolves very quickly, but there's stuff in place that we've been doing in obstetrics for decades that probably aren't going to go away. So I think overall, when I was making my decision and looking at my rotations, it was, you know, what could I see myself doing on a daily basis? What do I enjoy about it? What do I not enjoy about it? And on the worst days, how did I feel about it?
Wow.
So because everybody can do anything on when they're having a great time, but what can
That's
you
right.
do when you're not? You know?
And did you see yourself in one of your supervising doctors saying, "Okay, I like what she or he does and how he or she conducts herself or himself." Did you see yourself? Did you have a mentor that kind of said, "Josh, I think you'd be really good at this," or did you make up your mind on your own?
I think I made up my mind mostly on my own. I mean, where I rotated in El Paso, I mean, they were super busy, right? There's just there was not a lot of time for that. But I mean, my history. Over the years and experiences I've had, and just life itself to that point, I think that I was able to have some self-awareness there. But I do think what you're describing happened more intern year, actually, once I got to residency, where I had attendings that I could look at and really learn how to be a doctor, because I think that there's a book aspect of it, and then there's the human aspect of it.
Yes.
And I think that both need to be taught and demonstrated for us to learn. and learn effectively.
So your intern year, just for the audience, you finished 4 years of medical school.
Mhm.
You graduated, and do you apply for a fellowship in obstetrics and OBGYN?
Yeah, so you do your 4 years of medical school. You take all your USMLE, your board exams. You apply for residency in OBGYN, and then you can apply for a fellowship if you want. I chose not to go the fellow route, but your residency in OBGYN is 4 years, and so I started that back in 2015.
Wow,
And so yeah, and so your first year out of medical school is typically called your intern year, right? So
gotcha.
so for that, it's kind of your baby steps on how to be a doctor, right? Because I mean, technically you have your MD, but you don't know, you just don't know
Yeah,
how to be a doctor, right? So the goal of your intern year is really to I call it baby steps, but in truth, you're drinking, out of a fire hose. You're thrown into the fire.
you're throwing right in there,
Yeah,
right in the
yeah,
water.
exactly. And it's like sink or swim. So, um, but I was blessed to say I had some upper level residents that were great mentors and great teachers. And then I also had a set of attending physicians that were wonderful teachers and more importantly, good doctors where I could just watch them and see what they did, see how they treated people, see what was their idea of medicine, and then learn from it, and so that helped kind of mold my current practice.
So basically, how many years after you graduated medical school is the residency for obstetrics and OBGYN?
And so 4 years,
4 years.
yeah,
Sh-
4 years, and then you're graduated. Presuming you pass all 4 years, then you can kind of go out and practice on your own, and then you have board certification, which is a different kind of task and beast all in itself. So
In other words, you can practice, but you're not board certified. You're obviously a
correct.
licensed doctor.
Yeah.
But when we
Mhm.
read board certification, that physician, whatever they're certified in, has really undertaken tremendous
Correct. Yeah.
examination.
Mhm. Yeah, so
Yeah.
board certification typically for OBGYN, we're one of the few that still do oral boards in addition to written boards. So not only do you do your written board exams at the end of your 4-year residency, but then you case collect. So you record all your cases over the next calendar year. And then you submit them to the board, and then you all go down to Texas for a couple days, and you just get peppered with questions over your
Right.
cases. And these are your personal cases, right? So you defend your
Right.
practice essentially.
Sure. Sure. So before we go backwards, are you happy? You've been doing this for 10 years now or so. I,
Yeah.
I know it varies day to day. It depends on, I have good days and bad days, but overall, how do you feel now that, that residency is over and you're practicing in a hospital setting, it sounds
Yeah,
like,
yeah,
correct?
yeah, yep. Hospital. It's a hospital in practice. It's a little hard to do true private practice nowadays in OBGYN. But your overall question, am I happy? Yeah, absolutely. I mean, I love what I do. You're very correct. There's good days and there's less suboptimal days, right? But if you're asking me baseline, am I happy? 100%. That's
Yeah.
not a question.
Yeah, I remember you during the residency. You were wearing contact lenses, and I was
Yeah,
chasing you down in Texas, and I was worried about you. You said, Dr. D, I don't have time to breathe during this residency program. You just don't know. Do you want to kind of describe very briefly how difficult it was going through those a 4 year residency?
yeah. So you kind of alluded to it, right? As your intern, you're kind of just you're the lowest on the totem pole, kind of always, right? It's a little bit of earned right to show
Right.
up to the hospital maybe 2 hours short of like clinical hours, right? So
Yeah.
intern year, I was probably getting to the hospital maybe 4:35 in the morning and not leaving till I don't know, like call it 6, 7 p.m. But during residency, you work a lot. There is a or there used to be a cap, so to speak, on hours,
Right.
right? And the reason I put it in quotations is because everybody breaks the cap. It's
That's
it's a
correct.
it's a not an unspoken rule. Nobody, you're just there until patient care is done, right? Now, granted, I'm not sure what the ACGME rules have changed, but I would say bottom line in any residency, you'd expect to work hard, probably harder than you ever have in your life. Um, and and realistically, every single day you are learning volumes of information. May not be in your classical way by reading a textbook and sitting there and just reading a book, but you're seeing patients, you're trying your best to learn and keep up with everything.
Yeah.
So I would say residency wise, yeah, I spent a lot of hours working at the hospital, a lot of long hours, a lot of Taco Bell late nights.
Yeah.
But and you're right. It was you kind of don't see the light at the end of the tunnel until you're done.
Till you're
Uh,
done. Tell us how it feels to deliver a newborn. Because when my
oh
children were
gosh.
born,
It, it
it was,
it's a unique feeling from my perspective, um, and I don't think it changes regardless of how many babies I've delivered or to whom I'm delivering. Because for some patients, it's their sixth kid and they've gone through this so many times, but to see a baby take their first breaths is something that's truly remarkable. And then in other patients, it's a completely different experience because they've been trying for decades to have a baby, and this is the first one they've been able to have. And to see a dad, look at their son or daughter for the first time and a mom look down and just see that emotion kind of escape because they've been holding it in for so long, expecting something bad to happen. And here they have this life in their hands. Yeah, it's truly indescribable to see the miracle of life on there, with just right there in front of you. And I think that a newborn, or call it, it's a plus and a minus, right? Because I've delivered stillborns as well, which is the exact opposite, right? And so that's kind of one of those things that this field is particularly tough in, because I can have three patients laboring, and for the one patient, it's a day of such joy that they would never have imagined. And for other patients, it's the worst day kind of their lives.
yeah,
And I have to be able to navigate both. So I
yeah.
think that you go from such an emotional high to a very kind of subdued and empathetic and sympathetic environment. And you can do that all in a span of 5 minutes. Uh,
I know, and it could be 3 in the morning or 2 in the morning, and you got parents there. So, and you have to worry about the surgery and the mom.
yeah. Yeah,
You
yeah,
have two
correct. Yeah.
patients, don't
Yeah,
you? At
yeah,
least.
correct. Yeah, yeah. At least two patients, sometimes more.
Yes.
Yeah. Yeah. So
Well,
yeah.
that really is amazing. So, tell us a little bit about college. Did you always want to be a doctor? I know where you went to college, but the audience doesn't
Yeah.
know. Where did you
Yeah.
go to
Yeah.
college?
So I was at UT San Antonio for 4 years. I was there 2007 through 2011. And yeah, during that time, you kind of use that time to see what you want to do with the rest of your life.
Sure.
But during that time I was still volunteering in hospitals and trying to figure out, like, is this truly what I want to do? I mean, my dad, so it was engineering and or something medical related. My dad, had a law and science background, but so I think out of all that, I really enjoyed time, with helping people in some way, shape, or form. So I knew I wanted to do that. Um, I think, and to me, being in a hospital setting and volunteering and seeing what doctors do behind the scenes, right, was also intriguing to me.
So you were
Um,
studying, you took prerequisites,
mhm,
biology, physics,
yeah,
calculus, all that,
yeah, yeah,
thinking of medicine,
yeah,
but
yeah.
really volunteering and
Yeah,
things
to
like
try and
that,
make
trying
sure
to,
that that was what I wanted, right?
okay,
So you hate to not realize what you're getting yourself into, because I mean, the medical prereqs are no joke either, right? So it
that's
takes up a
right.
lot of time, and it points you in a certain scientific direction, where if your brain is not necessarily, not to say that you need a science true background to do medicine, but you do need to be somewhat, scientifically, biologically inclined.
Right. You're right. That critical thinking, you have to develop
Yeah,
it.
yeah,
And did you take your MCATs in your junior year? Like when you said, okay, I'd like to keep going. I think this
yeah,
is,
yeah.
I know we're
Yeah, I
going
think I
quite a
said,
far
yeah,
back,
I know.
but
I think I took my MCAT junior year. And then that set me up for applications for med school applications. Once I got that, and I think once I had solidified, like, yeah, I think I want to do medical school, right? And that's when I took my, sat down seriously and started studying for MCATs. And so I took a junior year, got my result, and that's when I think every college nowadays has an office that specializes in assisting students to go like the medical or like
Pre-med. Yep.
dental, yeah, pre-med, I think there were optometry students there too. And so like I think every office there, like every school has this office where they can reach out to, and that will help them through the process, because I'm certain it's changed since I've done it. But I'd reached out to them to see what do I need, what are the prereqs and classes I need, what are the GPA standards, what are the standardized test standards for the MCAT, what am I looking at? And then I had made friends with a student that was applying like a year ahead of me to medical school, so I had her for advice as to kind of like, what do I, also look into, what am I doing? Like, am I
Yes.
doing this correctly? Do I have everything?
Right.
She was a good
Right. Right.
resource. So I think you looking to your upperclassmen, if you have any, contacts that way, is also a big resource.
That was really good. I know in my career, I had two upperclassmen that helped me just navigate this overwhelming application experience, interview experience. So that's great advice. What
Yeah.
year did you go to the pre-med advisor? Do you remember? I know we're going, was it your freshman or sophomore or junior year?
I think I had formally gone my sophomore year,
Okay.
formally to make my, my ambitions known, so to speak. But I
Yeah.
had reached out to them, I think even in my freshman year, to say, hey, like, well, how should I build my curriculum as to like what classes I'm taking
Right.
when, how to best set myself up so that like junior year I can be set with all the prereqs to take my MCAT. So I think I had reached out to just for like form a skeleton schedule from that perspective, and then gone from there. And then obviously, my parents had looked at stuff, and I'd kind of run stuff by them. As far as college wise, it's like, okay, like does the math, right? Like working out as far as like, okay, if I want to graduate by this day, then I want to have all my, my stuff. I think it was a true gross team effort
Yes.
um,
Yeah. No
to do
man's
that.
an island, no woman's an
Yeah,
island.
yeah,
So let's go high school now. I'm calculating. I know the students are calculating. Okay, he went to 4 years of college, it sounds like.
yeah,
He went to 4 years of medical school,
yeah,
and it sounds like 4 years afterwards for
yeah,
the residency,
yeah,
correct?
yeah, yeah.
So if I
Right.
did my math correctly, that's 12
Mm,
years
yeah.
after high school.
After high school, you're correct.
Yeah. So now you're in high school. You probably knew you're very, very, very bright young man. You knew what was ahead of you and you did it very strategically. What advice would you now give someone that is thinking about a career as a allopathic physician,
Mhm.
osteopathic physician, a medical doctor? What advice would you give them in high school?
I think in high school, if you can learn the most about yourself, regardless of how you do it, be it sports, be it music or arts or whatever, right? I think knowing yourself is truly huge. Knowing how you deal with adversity is huge. And to some extent that comes with time, but at least knowing the basics, right? Is big. For myself, it was our sports background, my sister and I, and how we dealt with that, and losses and wins and that kind of thing, and then doing, hard training there. That kind of set me up for success later on in terms of like, both college, but like even truly like medical school and residency. So I think that if I was in high school, my bottom line would be kind of self intuition the best you can, right? Like,
Hard to
at
do
some of,
when you're,
yeah, exactly.
yeah,
Some of this it takes time, but also some people know they don't like blood.
yeah,
Okay, well, okay, there's not a ton of specialties where you're not going to see blood. They exist, but you kind of
yeah,
need to. And then what about helping people? What about being empathetic? What about being sympathetic? Do you like to talk to people? I mean,
yes,
I talk to people all day.
yeah,
So
yes.
it's one of those things, right? You
And they
have to.
talk to you all day.
Oh
And they
yes,
open up to you
yeah,
like they wouldn't
correct.
open up to their family members.
Absolutely. So I think knowing just those general things
Yeah.
I think can help point you to say, yeah, medicine is on my list of things that I could do,
Yep.
versus like, hey, I hate talking to people, and like the sight of blood just makes me vomit and all these things. It's like, okay, maybe, there's like one specialty in medicine that I can consider, but like perhaps the field is not for you.
Okay. Yeah. Uh, let's talk about sports because I remember you played tennis, you and your
Hmm.
at a high
Yeah.
level. I mean, you would go
Yeah.
to Florida, I
Yeah.
remember, and
Yeah. Yeah.
train and just unbelievable. I thought you were going to Wimbledon at one point. You were that, and you were young, but you were extremely competitive. But it seems like you also learned how to lose and
Yes.
how to
Yeah.
fall and
Yeah.
defeat.
Yeah.
And is that what you're referring to? Is
Yeah, I think that helps you. Also, we trained a lot, right? Trained a lot, trained
a
hard.
lot. How many
But
hours a day do you remember? A
gosh,
lot.
it was a lot. It was a lot between hitting practice and a lot. I mean, but all that is to say, I think that you know, it helped in the sense that I knew how I myself would handle adversity, right? And so, when I got to medical school, and you are, the adage of drinking water through a fire hose is pretty correct, because it's a enormous volume of information you have to put down.
Wow.
And then you know, expand on that to residency, where you work a lot, you know, um,
80 hours plus.
80
80
hours
hours
plus,
plus.
easily, easily. I mean, there were times where, gosh, it was triple digits, no, like without question. But, I think that drawing upon, okay, like I know how to train hard. I know what long hours feels like. Granted, nothing will ever, prepare you for when you're in the moment and you have to execute, right? So but at the same time, it's like when you have those days, and I had some of that to draw upon, I knew kind of how I personally react, how I I vent
Right.
frustration, and how I vent
Right.
exhaustion, and I vent, so to some degree, I kind of knew somewhat about myself. Now, granted, when you're in the moment, you will learn more about yourself than anything, but I at least had that to draw upon, and I wasn't kind of left without it. So, but that's my own personal experience. Do I think you need to have some crazy high funda testing thing to happen when you're in high school? No, not really. I mean, you'll learn when you're in the moment, and the other thing is you'll commiserate with your co-med
Yes.
students
Yep.
and co-residents, right? So it's not you necessarily by yourself, but everybody's going through it. So that's another big help, is you'll find your own set of classmates that you vibe with, and that's what will also help you get through.
And that's an important thing now because a lot of keep people vibe virtually and you need
Mhm.
to vibe
Yeah,
together,
correct.
because
Yeah,
you've said
yeah,
this twice now, upper
yeah,
class people
yeah.
helping you choose and also finding out how they deal with
Correct.
adversity
Yeah.
and these
And,
challenges.
and al- and also it's a proof that it gets better, right?
It does.
I mean, if there's a blind tunnel, right, you have no hope. But when
That's
you see
right.
the light, that gives you a sense that, like, hey, at some point, even this will come to an end. And to tell you the truth, I tell you what, like the scariest moment of my entire medical career was not while I was in residency. Scariest moment of my career was the first C-section I had to do on my own outside of residency, where I had no attending.
Wow.
And it's like, holy crap, like I'm responsible for the mom and this baby's life, and I don't have backup, right? It's you.
Right. Was it a
And
scheduled C-section?
no, no, it was very much on schedule. So
Why
so
don't
I
you
mean,
tell us
yeah.
about that, your first
Oh
time where
gosh.
let's get
It
because they
was,
may
it
not
was
know this. You're delivering a baby, everything's going as planned, and what happens?
Yeah, yeah. So I mean, I was on call, right, a rural hospital setting, and we had an emergency roll in, and this lady, term pregnancy. So term, for reference, is like past 37 weeks. I think she was like 38. Normal pregnancy to that point, but had had some bleeding earlier in the evening and came in, and in the triage bed, the nurse pulled the sheets back, and she had just a pool of blood she was laying in, and put a ultrasound on the kiddo, and baby's heart rate was like in the 50s or 60s.
Which is low.
um it's very low. Yeah, normal for a fetus at that point is like anywhere between 110 and 160. So 50, 60 is not good. Anyways, so called the I had assumed that anesthesia was in house. They're not.
Oh
um
no.
and so I was like, well, we're gonna do it. And so so we moved her to the operating room and did her C-section under local anesthetic under lidocaine effectively.
Oh my gosh.
Yeah, yeah. So
And your hand's shaking, isn't it?
no,
We could say
yeah, well,
no?
it's yeah, exactly. It's one of
Yeah.
those things, and it's like, the scrub tech's not there yet. So the nurse and I, we ripped open the operative pack and we put everything together and the patient's on the table. I luckily had a strong team of nurses keeping the patient calm and drew everything up quickly and injected and went. But like it was one of those things that was like, holy smokes, like it's just me, like I'm gonna be responsible for this kid, this mom, like
Yeah.
like the most abundant amount of prayers coming up from me up to the heavens was going on at that time. Luckily, I was at once I had the baby out, that's when anesthesia showed up and finally intubated the patient. And then the rest of the OR team was there. But like, I mean, I got the kid out probably in a couple of minutes.
And minutes,
Within
seconds matter.
yeah, yeah,
Seconds.
yeah,
I
yeah,
want the
correct.
audience to know
Yeah, yeah,
seconds
yeah.
matter.
Seconds do matter. Yeah. I mean, I think, you think back to residency, you would do C-sections quick. But this one was not one of my quickest just because I had to do all the setup myself.
Yeah.
But like in an emergent scenario, it was one of those growth moments that you're like, holy smokes, oh my goodness. But yeah, I mean, I think actually that patient's pregnant again, as of 2 years ago, and she has like two healthy little boys now. So
That's great. How did you
so
feel going home that night? Did you do the Superman walk? Like, I
no,
did it,
oh
man.
my
I
gosh,
did it. Or
I was
were
like,
you did just
it's
crash?
more, it's more like, God, I hope that kid is good. Like, I hope
Yeah.
everything goes well. I hope the mom is doing, it's one of
Yeah.
those gut check moments that you're going to really test your training to that point. Test your own skill, your own acumen, your decision making, because you have to be very decisive, right?
Yeah.
A lot of prayers went up from my own self in the moment, like, oh, God, I hope I'm doing the right thing, right? Like this is, yeah, I mean, the science, but when like I said, it comes down to execution, right? That's what matters, right?
Yeah.
Knowing the book answer, it's okay, but if you can't
Right.
execute the book answer, then it's all for naught, right? So, but yeah, that was my come to Jesus, like really, holy smokes, like you're in it for the long haul, and
Yeah.
so, but that was my probably scariest moment because you're on your own, right? You don't
Yes,
have a
100%. I can imagine that. That's just a great story. Just to wrap things up, when you were a kid, when you look back, do you say, I wanted to be in that position where I was looked upon as the person under pressure that
that
people
could
came
execute.
to?
Yeah, yeah, I think so. I think when I was a kid, it was a different impression because I wanted to play those points under pressure. I wanted to,
See
I
that?
wanted to, you wanted to be the man in that moment, right? So in a different
Right.
context, maybe, but
Yeah.
nowadays it's and again, like I can only stress this enough, right? Medicine is a team sport, so for me, playing an individual sport in tennis, I had to learn how to work within a team and work effectively within a team. Um, and so that is also what I think residency and everything taught is because you're not in a vacuum out here, right? Your best trauma surgeon, your best obstetrician, your best cancer surgeon needs their team around them. So it doesn't matter how high pressure or low pressure your job is, even if you're primary care and family medicine, you still need your squad of nurses, you still need your front desk staff, you need everybody, right? So I think that medicine is high pressure and high stakes in some degree, but also in a very team environment. So I do think um, that if I look back to my early self, sure, yeah, yeah, playing tennis, you had the highs of the highs, and you're like, yeah,
Lows of
you
the
won that,
lows.
yeah, lows of the lows, and you want to play that point, match point under
That's
pressure,
set.
be match point down, right? So,
Yeah.
but I think that I would say that's probably accurate. That I felt like I could execute in those moments.
Yeah. And what the audience doesn't appreciate is your path has been a rough one. I know that because I've been your doctor. And I just can't tell you how proud I am. I don't know if that's condescending because, you've been a physician for so long at such a high level. But when I say you do God's work, you really do God's work. It's something. My first exam, I was shaking when I did it by
Yeah.
myself. And I
Oh
just
yeah.
said, better
Yeah.
one, better two. Okay. And not delivering a baby under the most stressful of conditions, and it is God's work. So, Josh, I can't thank you enough. I think the students who are listening to this, something has resonated with them, and it will help them persevere the bumps along the road. And for the audience out there, Joshua is a special individual, who comes from a special family. And when I looked at his reviews, which, let me tell you, it's not easy to get good reviews as a physician, as an obstetrician, or any doctor, you'll know just what a special physician he is. So, Joshua, on behalf of myself and my entire patient base, thank you so much for coming
Yeah,
on during your lunch
yeah,
hour.
I appreciate you having me. I'll close with one thing. I will say this. I think that for your young patients out there, if you're looking at medicine for its financial gain, don't do that.
Yeah,
There's much better and much easier paths to
yeah,
that. And which is not that, again, if finances is your utmost goal, 100% chase it. I
right.
have I have nothing but the best, but I think that if you're looking to go into medicine because of its financial compensation, that's just a poor way to do it, and you'll be miserable. I think
Yeah,
that if you want to go into medicine, you really have to want to help people because I think that even on your worst days, you kind of have to remind yourself why you got into medicine in the first place, and realistically, it should be to help all those who need care and need help. So I think if I were to advise a high school student, my number one is, do you want to help people? Do you want to
yes.
help those who need it?
That's such an important point, because you can't be a good physician without listening to people and without
Correct. Yeah.
caring.
Yeah.
But we do gain something that money can't buy,
Yeah.
is the gift of knowing we've helped someone in a
Certainly.
special way.
Yeah. Yeah.
It
Yeah.
really
I
is.
think I think it's and I think you also, I think it's truly, and students who will go through this will hopefully learn this, but it's a privilege to earn the trust of somebody to be vulnerable and have another complete stranger take care of you. It's truly a privilege, and it's a privilege that is earned and not given, right?
That's
So
exactly right.
I think that that's a poignant point when somebody begins their medical career or nursing career or whatever, right? It's truly a privilege to take care of somebody, and so it's one of those things that in medicine I think perhaps maybe getting forgotten and to some degree, and so. But yeah, it's not a right to take care of somebody. Somebody has to grant you their trust. So
Yeah, I couldn't have said it better. So, Dr.
but
Paul, thank you so much. I
I
I
appreciate it.
thank you on behalf of myself and my patients and everyone who listens to this podcast. So, until
Absolutely.
next time, everyone, just have a great day. Thank you so much. I'm Dr. Nick Despotidis, and in this podcast, I sit down with my current and former patients, people I've known since childhood, to talk about their careers, the challenges they faced, and the choices that shape their lives. I've always been intrigued by patients sharing their story with me in the exam room, and I came up with the idea of this podcast to share these gems with my current patients because I feel strongly parents and students can benefit from their peers' experience.